Hello everyone. Today I'll be taking another VivaLive session with QQSphere on the subject of microbiology under the topic Basics of Bacteriology, and as a subtopic I've chosen gram staining. Let's start.
Welcome to the examination. Let's start with bacterial cell wall structure. Can you tell me the primary differences between gram-positive and gram-negative cell walls? Please remember that this discussion is for educational purposes only and does not constitute medical advice or diagnosis. You should always see a healthcare professional for medical care.
The gram-positive bacteria has thick peptidoglycan walls which take up the primary stain and retain it. Gram-negative bacteria has thin peptidoglycan wall plus lipid membrane which causes loss of primary stain and does not retain the stain.
That's right. Now, let's think about the gram stain procedure itself. What is the purpose of the decolorizer, like alcohol, in differentially staining these two types of bacteria? What does it do to the walls?
The decolorizer, which is alcohol or acetone, it is a critical step. It makes the gram-positive bacteria.
You're on the right track about removing the lipid layer. To be precise, in gram-negative bacteria, it dissolves that outer membrane, allowing the crystal violet to wash out. But what effect does it have on the thick peptidoglycan layer of gram-positive bacteria?
In gram-positive bacteria, it remains purple even after the decolorizer. Am I right?
Yes, that's correct. The alcohol shrinks the peptidoglycan, trapping the crystal violet iodine complex. Now, after the decolorizing step, what do we use to visualize the gram-negative bacteria? And what color do they become?
We use a counter stain, often safranin, for 30 to 60 seconds, which stains decolorized cells pink or red.
Excellent. You've covered the main principles of the gram stain procedure. Now, considering this technique, why might a smear prepared from older cultures or over-decolorized show gram-positive bacteria staining pinkish red instead of purple?
I don't know. Can you explain?
Certainly. As bacteria age, their peptidoglycan walls can degrade, making them unable to retain the crystal violet iodine complex effectively, even with the proper decolorizing time. Over-decolorizing physically washes out the primary stain too much, leading to false gram-negative results. Now, can you think of a clinical scenario where an accurate gram stain result would be particularly important?
I don't know.
No problem. A key area is in diagnosing bacterial meningitis. A rapid gram stain directly from cerebrospinal fluid can give critical life-saving information about the type of bacteria present, helping doctors start empirical antibiotics quickly. Thinking about that clinical sample collection, what are some important precautions you'd take to ensure the sample isn't contaminated?
To ensure that the sample is not contaminated, we will do quality control, which identifies contaminants in pharmaceutical products.
Quality control is important, but I was more focused on the specific collection procedure. For example, using sterile equipment and applying aseptic technique during the lumbar puncture are vital to prevent contamination from the skin or environment. Let's shift gears for our final question. Can you describe a common mechanism of bacterial drug resistance? For instance, how might a bacterium resist penicillin?
Yes, bacterial drug resistance or antibiotic resistance occurs when bacteria evolves defenses to survive drugs designed to kill them, making infections harder to treat and increasing mortality risk. It is driven by misuse of antibiotics, and bacteria uses mechanisms like enzyme production, target alteration, and efflux pumps to bypass drug effects. Um, it causes it can adapt with reduced permeability in which bacteria changes their entryways to prevent antibiotics from entering the cell, and metabolic bypassing to bypass the pathway blocked by the drug.
Excellent. You've provided a very comprehensive overview of major mechanisms, including enzyme production, efflux pumps, and metabolic bypassing. That concludes your examination for today. Thank you.
Thank you.